Bismillahirrahmanirrahim. Assalamu alaikum dear students. Welcome to your channel The Anatomy Canvas. In today's class we are going to discuss with the MCQs of the reproductive system. So here is your first MCQ that during proliferative phase of the endometrial cycle there is a discharge of the blood and debris from the vagina. There is increase in endometrial vascularity, increase in follicular estrogen secretion, more uterine glandular secretion and peak in the progesterone level. So please remember we are talking about the proliferative phase of the endometrial cycle. So discharge of the blood and the debris from the vagina takes place during the menstrual cycle. Menstrual phase of the menstrual cycle. Increase in endometrial vascularity occurs in the secretory phase, and the increase in the estrogen secretion basically by the follicular cell occurs in the proliferative phase, and more uterine glandular secretion again in secretory phase and progesterone level again in secretory phase. So in this diagram you can see over here that that this one is the first phase, this is the proliferative phase, and in this proliferative phase there is the high concentration of the estrogen level which causes the increase in thickness of the endometrium. In this estrogen causes proliferative changes in the endometrium. So correct option is C. Next MCQ is that during secretory phase of the endometrial cycle, there is decrease in endometrial vascularity, decrease in estrogen secretion, discharge of the blood from the vagina, or peak in the progesterone. So again look at this, this is the secretory phase. So in secretory phase there is increase in vascularity of endometrium, there is decrease in estrogen secretion, discharge of the blood from the vagina in menstrual phase. Main important event in this phase is peak in the estrogen level. So this is the option, this option is the answer, D option is the correct option. So in this diagram you can also see this one is the secretory phase, and in the secretory phase the high level of the progesterones are present along with estrogen. Both the estrogen and progesterone are increased, but level of progesterone peak during this level and this phase, and it causes secretory changes in the endometrium. So correct option is D. Next is during ovulation, release of the secondary oocyte is initiated by. So there are the different factors which causes release of the secondary oocyte during process of the ovulation. That may be estrogen, that may be FSH, GnRH, LH, or lysosomal enzyme. Here again you can see that during the ovulation there is a surge of LH hormone from the anterior pituitary which causes the release of the collagenases over here in the localized stroma of the endometrium, weakening of the stroma of the endometrium over the area of the Graafian follicle, and release of the Graafian follicle which causes ovulation. So the correct option is the LH hormone which increases which causes release of the secondary oocyte in the ovulation. Next MCQ is isthmus of the fallopian tube remains spastically contracted for about first 3 days after ovulation. The substances secreted by the ovarian corpus luteum leading to isthmus relaxation, allowing the entry of the ovum into the uterus is either estrogen, the human chorionic gonadotrophin hormone, oxytocin, the progesterone, or the relaxin. So these are the different hormones. First look at the time. This is just 3 days after the ovulation. It means that it is the secretory phase in which the usually the ova is present in the ampullary part of the fallopian tube where the fertilization is taking place. So estrogen do not causes the spastic contraction. The HCG is not related to this. Oxytocin have nothing to do over here. This is the progesterone which is very important over here. This progesterone has specific type of the receptors, the type B receptors, which are present in the in the epithelium of the fallopian tubes, and it also has the receptors on the smooth muscles of the fallopian tube, so leading to relaxation of the smooth muscles of the fallopian tube in the isthmus parts leads to little bit widening of the lumen of the isthmus, which can help us to propel the zygote through the isthmus into the uterine cavity. So correct option over here is the D, that is the progesterone. Next is, while studying a germ cell line developed from the patient testicular biopsy, the researcher notes that the colchicine treated cell blocked in metaphase have 46 chromosomes. From which of the following region of the male genital tract would you expect these cells to have originated? So these are the different options. First, you have to concentrate about the 2 points. First, colchicine treated cells in metaphase. This is a requirement to study the analysis of the chromosome, because we give the colchicine to arrest the cell division and when the cells are spread at the metaphyseal plate. Another important point which you have to notice is the number of the chromosome. So this is the 46 chromosomes, and we all know that the spermatogonia type A pale, type A dark, type B, and primary spermatocytes, all of them having the 46 number of the chromosomes. The primary spermatocytes then starts the meiosis 1 and enters into the secondary meiotic division. So here in this diagram you can see this compartment which is present over here. This is the basal compartment in which all the spermatogonia and primary spermatocytes are present. When primary spermatocytes starts the first meiotic division, they enter into the abdominal compartment. So while we are doing the study on the cells having 46 number of the chromosome, we will collect the sample from this region. So the option over here are that basal lamina of the seminiferous tubules, in middle region of germinal epithelium, within abdominal compartment of seminiferous tubules, within Retti's testes, or within the straight tubule. So this is the basal compartment. So we have to concentrate upon the point that this chromosome number is 46, and 46 chromosome number is present in the cells which are present in basal compartment of the seminiferous tubule. So correct option is A. This is a tricky question. Next is very easy question. The Leydig cells are located in, you all know this is the slide of the testes. These are the seminiferous tubule, and this is the interstitial connective tissue in which you can see the Leydig cells are present. So the option is the testes. The E option is correct. Next is, a newly married college student missed her period. She was advised by her college friend for the urine test. This test is used to check the presence of the estrogen, the HCG, the oxytocin, and the progesterone. So very simple question. HCG, that is human chorionic gonadotropin hormone, is used to check the positive pregnancy test. Next MCQ is, inhibition of the uterine contractions during labor can be done by either the injecting FSH levels, FSH hormone, injecting LH hormone, the oxytocin, the progesterone, or the prostaglandin. So remember, these are the uterine contraction, and we are going to inhibit the uterine contraction. The Oxytocin causes increase in uterine contraction. Both FSH and LH levels are raised. At the end, the prostaglandin E2 is also very important because it increases the contraction. It is only the progesterone hormone which decreases the uterine contraction and which can stop the premature labor. So the correct option for this question is the progesterone, that is D option. Next question is, which of the following inhibit the labor factor? That is administration of the antagonist of the progesterone, administration of antagonist of the prostaglandin, administration of oxytocin, and dilatation of cervix. So remember, this is again we are going to inhibit the laboring factors. So the progesterone is actually going to inhibit the labor itself. Whenever its antagonist is given, it will start the labor. So this option is wrong. The antagonist of prostaglandin E are usually given to start the labor, and whenever their antagonists are given, they can stop the labor. Similarly, the administration of the oxytocin and dilatation of the cervix, both of these two factors are required to start the labor. So the correct option over here is the prostaglandin antagonist, because it antagonizes the effect of the prostaglandin, thereby inhibiting the progress of the labor and stopping it. Progesterone level is highest in before ovulation, duration from the menstruation to ovulation, duration from ovulation to menstruation, first day of menstruation and the last day of menstruation. So here you can see these are the different phases of the menstrual cycle and the different hormones. In the first half of the cycle, you can see initially FSH is present, along with the increase in the level of the estrogen. At mid-cycle, there is a surge of LH. After that, there is a plateau in the estrogen but a raised in the level of the progesterone in the second phase. So for this MCQ, that the highest level, the progesterone level is highest in the phase that is from the ovulation to the menstruation, this phase. So correct option is C. Next MCQ is 30-year-old women, 10-week gestation, have previous 3 spontaneous abortions, have progesterone is low. Which hormone is required to maintain the corpus luteum? That is antidiuretic hormone, the estrogen, the FSH, the HCG and LH. So this is the HCG hormone which is required to maintain the corpus luteum. When corpus luteum is maintained, then this corpus luteum secretes the progesterone itself to maintain the pregnancy. So in this phase, the patient has the luteal phase insufficiency, and we have to help the corpus luteum. First, we have to give HCG hormone to maintain the corpus luteum, and then corpus luteum will be able to produce the progesterone. Next is menopause occurs due to different factors are given here, that decrease in number of the follicles available in ovary for stimulation by gonadotrophic hormones, negative feedback effect of estrogen and progesterone on posterior pituitary. This option is wrong, because in cases of the menopause there is higher level of the estrogen and progesterone are even not produced in case of the menopause, because ovulation is not taking place. Then reduced rate of secretion of progesterone from corpus luteum, again as corpus luteum is not there, so this option is again wrong. The reduced level of gonadotrophic hormone secreted by anterior pituitary. This option is again wrong, because there are higher level of the gonadotrophic hormone from the anterior pituitary, which is an indication for the menopause. Then reduced responsiveness of the follicles to stimulatory effect of the gonadotrophin. Again, this option is wrong, and correct option is that the number of the follicles are reduced, which may be available for the stimulation by the gonadotrophic hormone. So A is the correct option. To prevent the neural tube defects in the fetus which is given to the pregnant lady, very simple question. This is the folic acid which is given to prevent neural tube defects. Next is parenchyma of the parathyroid glands consists of the aldosterone, the mesenchymal cells, the oxyphil and chief cells, parenchymal cell and parietal cell. Obviously it contains oxyphil and chief cells, and C is the correct option. Which maternal infection in early pregnancy causes multiple fetal abnormalities, including cardiac abnormalities, deafness, eye problems, and mental retardation? So, number of abnormalities are written over here. Genital warts usually do not cause these abnormalities. The same is the herpes simplex. It causes little bit the deafness, but not the cardiac anomalies. Rubella is the main factor which is responsible for cardiac anomalies, for the deafness, for the eye problem, and mental retardation. Syphilis can also cause these abnormalities as well, but in cases of the syphilis, there is no deafness. Similar is the case with the toxoplasmosis, in which eye problems may be present, mental retardation may be present, but all of these abnormalities are signs of the rubella. Next question is pelvic inflammatory disease an absolute contraindication for. This is a very important MCQ, especially in part first examination, that the pelvic inflammatory disease is an absolute contraindication for intrauterine contraceptive device, and this is the correct option. During pregnancy, muscle of the uterus is intact. After ninth month of gestation, uterine muscles get excited. This excitability is attributed to the decreased estrogen production, increased blood flow, increased progesterone production, and oxytocin. So oxytocin is basically the factor which is responsible for excitability of the uterine smooth muscle cells in myometrium. The urinary excretion of which of the following substance is used to diagnose disorder of the testes and the adrenal cortex? So, 17 beta ketosteroids, the beta estradiol, the estriol, HCG, and pregnanidiol. So we are looking at the disorders in which the substance is released both from the testes and from the adrenal cortex. So this is the byproduct of the androgen hormones, which are mainly released from the testes and small amount released by the adrenal cortex. And these androgens, their byproduct is 17 beta ketosteroid, which is excreted in the urine. So this is the correct option. Next MCQ is penile urethra is derived from the cloaca, the mesonephric duct, the pelvic part of the vesicourethral canal, phallic part of the vesicourethral canal, are the urogenital sinus. So here is the diagram. You can see this urogenital sinus divided into three parts. The first part, upper part, mainly forming the urinary bladder. The middle part, also called the pelvic part of urogenital sinus, which will form prostatic part of the urethra and membranous part of the urethra, and this part, the phallic part of the vesicourethral canal or the urogenital sinus, will form the penile urethra, which is also called spongy. So this is the correct option over here is the D, that is phallic part of the vesicourethral canal. Next is, after the sinovaginal bulbs have proliferated and fused, they form a solid coat of endodermal cells known as. So this is the case in which sinovaginal bulb fuses. Actually, this will be the condition in the female genital tract. So in such a case, the prostatic, utricle, and these conditions are excluded. Look at this diagram. Here you can see this is the area where the sinovaginal bulbs have proliferated and they are forming a solid plate, and this plate is called the vaginal plate. So this is the correct option. The D is the answer. Next is, in female embryo, the origin of the labia minora is either the cloacal membrane, the genital swelling, the genital tubercle, the sinovaginal bulb, or the urethral folds. So in this diagram you can see over here in the females, this is the area where the urogenital groove is present. On each side of the urogenital groove there are the urethral folds are present, and on each side of the urethral fold genital swellings are present. So these urethral folds will differentiate into labia minora, while the genital swellings will differentiate into the labia majora. So the next MCQ is that in male embryo, the embryonic origin of the penile urethra, it takes place from the cloacal membrane, the genital folds, the genital tubercle, the urethral fold, and urogenital sinus. Almost the same type of the question with the previous slide, but a little bit different options. So here you can see again this is the urogenital sinus, and from the phallic part of the urogenital sinus the penile urethra develops. So here the option given is urogenital sinus, and this is the correct option. Next MCQ is, which structure is not derived from the primitive urogenital sinus? So the urogenital sinus, the ejaculatory duct, the female urethra, lower vagina, male urethra, and most of the urinary bladder. So we all know that female urethra, lower vagina, Male urethra, almost all of the male urethra and most of the urinary bladder, they all develop from the urogenital sinus, while the ejaculatory ducts are formed from the Wolffian duct or the mesonephric duct. And here you can see in this diagram that this Wolffian duct or mesonephric duct forming the vas deferens, and here they contribute to the formation of the ejaculatory duct. So answer A is the correct option. Next is female urethra is closely associated with genital swelling, with mesonephric duct, with paramesonephric duct, or the urogenital sinus. So in this diagram you can see over here that this is the diagram of the, in which you can see this one is that of the male, and here you can see the area which are forming the female genitalia. In the center you can see the urogenital orifice which is present. On each side you can see the urethral swelling forming the labia minora and the genital swelling forming the labia majora. Here in this stage of development you can see the the urethral orifice is present. Over here, here is the vaginal orifice. On each side labia minora and labia majora is present. So as these all structures are in close relation to the urogenital sinus, so correct option over here is D. Vas deferens carries sperms from epididymis to the ejaculatory duct, the membranous urethra, the penile urethra, the prostate, or the urinary bladder. So here in this diagram you can see that the sperms are carried from the epididymis to the vas deferens. Here you can see this is the course of the vas deferens, and this vas deferens enters into ejaculatory duct, which enter into then the prostatic part of the urethra. So correct option over here is the ejaculatory duct, because vas deferens carries sperms from epididymis to ejaculatory duct. The prostate is related close to epididymis, lower end of the ureter, the neck of the bladder, upper end of the ureter, and vas deferens. So very important and very easy question. The ureter is basically related to the neck of the urinary bladder. Here you can see this is the bladder, and on each side you can see the prostate gland is present, and it is related to the neck of the bladder. So C is the correct option. Thank you very much for your attention for the today's class, and inshallah we will meet in the next class with the part 2 of the MCQs of the reproductive system. Allah Hafiz till the next class.